So it's kind of like a plant that we are trying to nurture, and when the plant is in its inception and early stages of developing and coming up, the smallest trigger and trauma could destroy this plant. So the plant cannot even survive by that small disruption. So the oral phase of the development of a child is extremely important. If there are rejections, if there are problems related with abandonment, parent not being there, the mother's depression, not being able to attend to the child, this relationship could be seen as a very hostile, extremely dangerous, and destructive. And therefore, in adults and adolescents and people who've had severe crisis in their oral stage of development, there could be seen severe disorders, severe explosive disorders, schizophrenia, severe rage related paranoia, paranoid personality, inability to trust at all, severe problems with regard to relationship with the object world, with the world surrounding the child, as far as relationships with merchant, relationship with people, siblings, family, and then all the concepts and complicated factors that get involved with each other, and then add up to that mistrust. So the basic mistrust is going to be there. The next stage of development, basically what I'm talking about here is just a very somehow simple and fast kind of like going through these phases. Very complicated, obviously. It's not as such to be discussed in 10 minutes or 15 minutes, but still we can discuss that so we know where we're coming from. Next stage of the development would be the anal phase. Now these phases are not written on stone, and these are the phases that psychologists has set in certain different types of schools of psychology has come up with this ideation of these phases of development. So there are different kind of like ways of looking at the stages of development. Now this next one would be the anal phase. Anal phase is a phase of the development that mostly there is some understanding of control and the ability to have power over things, and the ability to express our emotions more kind of like controlled, and to keep it to ourselves or let it go. It's like basically like a fecal movement of the gastrointestinal system, that the child begins to learn how to control the sphincter of the anal sphincter, to be able to control the feces and to control the urine and all that. So it's basically this stage of development goes through around 2.5, 3 years old to 4 or 5 years old, when the child is beginning to understand the controlling attitude and issues related to that. Now this is actually again another phase that the child at this phase is beginning to separate, to be able to walk from age 2 to 3 to 4, then mastery of walking and running, and then the separation stage is another stage that is being developed and worked through. And then if there is a problem related to caring and interrelationship of the mother, father, and the child in this stage of development, then there could be a fixation in this stage of development, which could exhibit itself then in the mature individual as a obsessive compulsive disorder, obsessive personality disorder, very conservative attitude, not being able to make decisions, indecisiveness, problems related to expression of emotions on a free association and fear, and then retentive behavior of the child. So then the most kind of conditions with regard to obsessive compulsive disorder, and then problems related with susceptibility of the relatedness of the child to his or her environment could ensue because of the problems related with the trauma that has been felt at this stage of development. Next stage would be the Oedipal phase. The Oedipal phase, now again I'll just go back a little bit and talk about the problems related with the intimacy and fear of intimacy. Now if we have a child who's being brought up in a situation where the father or the father figure has problems expressing their emotions and their feelings, and not being able to achieve an ability of understanding and caring and listening and hearing their children when they have emotional instability, then the problem